Joining us today is Dr. Terri Lutes, ND. She is a naturopathic doctor practicing in Sault Ste. Marie since 2003. Her naturopathic practice primarily focuses on women's hormonal health. Welcome, Dr. Lutes. Thank you for joining us today.
Thank you for having me. I'm happy to be here.
Thank you. And I'd like to start out by hearing a little bit more about you. So if you could tell us a bit about yourself and also how you became interested in women's hormonal health.
Sure. So as you mentioned, I'm a naturopathic doctor and I've been in practice in Sault Ste. Marie since 2003, so for 17 years. And the focus on women's hormonal health was just a natural evolution in my practice from the concerns that women were coming to me with and the types of issues that they were looking for solutions for. So it, became my role to step up and really learn more and develop a focus in that practice, in that area.
That's great. I think it's so amazing that you really navigated in the direction of your patients and what they were asking for to really serve their needs.
Absolutely. It was definitely driven from the patient population coming to see me.
Mm-hmm. It's such a common concern these days, and even the term hormone is used a lot. Can you define what hormones are and what their function is?
Sure. So hormones are chemical substances that are produced in the body. There are synthetic hormones, but we'll talk about the ones produced in the body. And they control and regulate certain activities in different cells and different organs. So they're basically chemicals that our body will produce that will then travel through the body and have an effect on cells and on organs and regulate activities in the body.
It's so fascinating to think about the influence that they could have on our bodies, and that they're, just these chemicals that are naturally produced. I think it's really interesting to consider that as a concept, because I don't know that women even stop to really think about that sometimes. And I think it's really great to go back to the foundations and understand those.
Absolutely. So these chemicals will go and attach to the cells and give instructions to cells on what they need to be doing or what they don't need to be doing. So they really will have a wide impact on our body, on our body's functioning.
So what are some potential signs or symptoms that a woman may experience if she's having hormonal issues?
So we can see a variety of different symptoms depending on where a woman is in her life. So even just at the onset of menstruation, for example. So sometimes people might feel that they're having irregular cycles initially when maybe their cycles every 6 weeks. And if we map it out, we see, yeah, you might be missing a month, but you're not really. It's every 6 weeks, let's say. Coming into, let's say, our 20s, 30s, women might be experiencing something like polycystic ovarian syndrome, which can manifest in different symptoms in different women. Some women might find that they have increased weight gain or difficulty with weight loss, irregular cycles or cycles stopping altogether. Women might notice signs of excess male hormones, so they might experience acne or oily skin, facial hair growth. So those are some symptoms that women could experience with polycystic ovarian syndrome. Also PMS. So women might notice that they're feeling symptoms before their menstrual cycle starts. So they might be feeling bloated, like excessively bloated. They might have a headache. They might have back pain or breast tenderness. They might have mood changes, specifically premenstrually. So right before their cycle starts, they might feel more down. Perhaps they feel more anxious, and then their cycle starts and they feel a wave of relief. And then moving on into perimenopause is when cycles can start to become irregular. Cycles might start to become heavier. And women can start to experience hot flashes, sleep difficulties, and then transitioning into menopause where those symptoms can carry through as well.
I think it's helpful to know the key symptoms to look for that could be an indication that something is off in terms of hormones in our bodies as women. And you mentioned PMS. This is something that it seems like so many women accept that it is just part of being a woman. Can you speak a little bit more to that?
I agree with that completely. We accept it as being normal because it honestly is the norm. A lot of women experience PMS and they just, chalk it down to, oh, well, it's PMS, but it's not a natural process. It's not something that women need to experience. Other than looking at the calendar and knowing, oh, my cycle should be starting soon, we don't need to be experiencing these symptoms. And that is a sign of hormonal imbalance. So, we accept it as the norm because a lot of women experience it, but we don't need to be suffering with those symptoms, and it's not a natural process.
Thank you so much for sharing that because I think just because something is common doesn't necessarily mean it's normal. And I think it's helpful for women to know that, dysfunction and discomfort are not normal.
Exactly.
Okay. So you also mentioned perimenopause. Can you tell us more about what that means and what that could mean for the hormonal changes you mentioned?
So perimenopause is a really big frame of time leading up to menopause or up to the sensation of menstruation. So perimenopause can span a time span of 10 years. It can start as early as 35. And it's a time when we're seeing a lot of hormonal fluctuation. Throughout perimenopause, our estrogen level is kind of on a bit of a roller coaster. It was going up and down significantly through that time frame. And our progesterone is pretty much on a slow decline. So throughout that time, and it's a long time span, women can be experiencing symptoms.
Okay, that's helpful, I think, to define that time period and what perimenopause is, to also give an expectation of what's normal and where that may not be normal. What are common triggers for hormonal imbalance that might occur?
There's a variety, so many triggers for hormonal imbalance. One would be our stress level is a huge trigger for hormonal imbalances because when we're under stress and we're producing more cortisol as our stress hormone, cortisol can really have a negative impact on the way other hormones can get to the cell and do the function that they're meant to do. It kind of gets in the way and can block that. So being under a lot of stress, which happens, but backing up and looking at stress management is a huge component of helping with overall hormone balance. And there's lifestyle factors as well. So in terms of nutrition, and there's certain foods that are naturally higher in hormones and can throw our hormones off more. Foods that can be beneficial and bringing those in can really help bring things back into balance. So a lot of things are within our control to address the symptoms that we're experiencing, whether it's stress management, shifting our nutrition a little bit, physical exercise, activity, all of those sorts of things.
Which is so empowering to know, because if you feel like you're just riding the waves of something that is not within your ability to influence, that can be, really difficult and leave you feeling helpless. But if you have a sense that, well, actually, these are things I could modify and see an impact on, then that's a really good place to be.
Absolutely. There's so much that we can do that can nudge things in the right direction. Small changes can have a huge impact on us feeling better.
Mhm. In terms of your practice, who are the typical clients or patients that you see? Because I know that you mentioned in the beginning that you've really shifted your practice based on what the needs are. So who would that typical woman be?
So I do still have a general practice. I do see, different patients for different concerns. But in terms of hormone balance, it's women who they know their bodies. They know something's off. They know something's not right. They're the best expert in their health and how they're feeling and when things are changing. So they're women who are noticing these shifts, these symptoms that are coming up, and they're looking for solutions to get to the core of why am I feeling this way, what's going on in my body, and what can I do to kind of course correct or help with these symptoms and bring things back into balance overall. So it's women looking to dig deeper into the whys of what's going on and how do I How do I shift this?
Yes, the why is so important. So it sounds like in your practice that you're providing education also about what is happening, which I think is so important.
Education is key. So if women can understand why they're experiencing the symptoms they're experiencing, what outcomes are we looking for when we're asking to make these dietary changes or these lifestyle changes? Why are we doing this? What kind of effect are we looking for? So that we can monitor, okay, this is what we did. Are you noticing a shift? Are you noticing a change? And then incrementally building on those changes over time. But education is key. People need to understand why am I doing this? What am I looking for? Because ultimately the goal for everyone is to feel more balanced and to feel better.
Yeah, very true. I like the way that you put that. Also wondering, are there specific women that might be more at risk than others for developing hormonal concerns?
That can definitely shift over time. Certainly when we're under a lot more stress, that can be a time when we start, we know stressful times, our menstrual cycle can be a little bit wonky. So we can directly see the effects of stress on hormones. We see that with acute stressors, but then also we need to look at the impacts of long-term chronic stress. That can be a factor as well.
Yeah, I think it's important to consider if there's something situational going on. It might not be some inherent risk factor about you or genetics or anything like that. It might be more specific to what is happening in your life and circumstantial and how you're responding to it.
Absolutely. And what you bring up with genetics, genetics are a risk factor, but a lot of our lifestyle factors really have an influence on the expression of genes. So just because we have a gene does not mean that's going to express. It's not inevitably our fate. There are a lot of things that we can do to, say, turn off genes and affect their expression overall. So it comes back to lifestyle again.
Yeah, which is amazing because again, it's so empowering to know that if you just feel like you're a victim to what your family history is and you have no control, then what's the point of doing anything?
Absolutely. And we know that's not the case.
Hmm. Yeah, thank you for sharing that. Are there any common obstacles that women that you see might encounter that, maybe they're struggling with hormonal imbalance and they just can't overcome it?
I'd say one obstacle could be mindset. Like we were saying, backing up a little bit, thinking, well, this is normal. I talk to all my friends feel this way. We're all in the same time in our life, so this is normal. When, it's not necessarily something that we need to continue to deal with. So part of that is shifting our mindset to, well, maybe a lot of people are experiencing this, but do I need to be feeling this way? And is there something I can do about it? So that would be one piece. Other obstacles, we tend to be really busy and finding time. We need to carve out time for self-care, time to implement the steps that are going to shift us into the direction of balancing our hormones more. And it doesn't mean we have to spend hours every day, but prioritizing that time for whatever it is, whatever piece we need to start to implement to start to shift us in that direction.
Yeah, very true. And I think it's interesting you point out the social aspect, how sometimes that can confirm maybe our bias that we can't be helped. But then also we may become a leader in our circle of friends and family pursuing, higher levels of wellness. So that can sort of go both ways and we can have a positive impact on others if we're seeking that health and wellness for ourselves.
Absolutely. I mean, we can bring that information forward to our friends and then say like, hey, I'm feeling so much better. This is what I did. And knowing that, we don't need to feel like this.
Exactly. And I think you bring up an important point too about time, because I know in my practice too, that is a really commonly cited reason. And I think the way around that is also to reprioritize. So sometimes it's less about time than we think it is. And it's more about how important is this to us on our list of to-dos.
That's a really important point. Yeah, prioritizing our time is something we all need to do.
Yeah. So even though we might face obstacles in trying to get well, that there's certainly ways we can overcome those obstacles. Oftentimes it has to do with our thinking about it.
Absolutely.
Hmm. So are there any specific health practices that you might recommend for promoting better hormonal balance?
Self-care, coming back to time, coming back to stress management, that looks different for different women in terms of what makes them feel more relaxed. What do they feel need to do to lower their stress response? It could be having a bath. It could be knitting. It could be a yoga class, meditation, going out for a walk, getting outside. Everyone resonates with something a little bit different. So I'll also encourage people, try different things out, find what resonates with you. And then focusing on nutrition has a huge impact, and digestive health has a huge impact on our proper processing of hormones and elimination of hormones. So looking at our digestion, maybe there's some things that aren't working so great there that we can drink more water, or simple things, but focusing on digestion and making sure that our digestion is working optimally
Hmm.
else that can have an impact on hormones.
For sure. And can you say a little bit more about specifically how that impacts hormones? Because that might be a new piece of insight for women to hear that digestion actually impacts hormonal health.
Well, there's a couple of factors with that. One is just basic elimination from the body. So when our body is done with hormones, they're going to get processed through the liver and dumped into the intestines, and we need to be eliminating them. So if we're not eliminating regularly, we're not eliminating our hormones efficiently, and that can lead to an imbalance of hormones overall. So something as simple as bowel regularity does play a really important role in maintaining our hormone balance. Backing up to our liver's role in digestion, so our liver is really involved with processing our hormones. So if our liver is not functioning optimally, and I'm not talking about a disease or pathology or elevated liver enzymes on blood work or anything like that, but just some gentle support to the liver in terms of processing our hormones, that can be really helpful. And then getting back into the gut, there's bacteria in the gut that can actually, there's a tag that we stick on estrogen when our liver is marking it for elimination, saying we're done with this, sending it into the intestines. And if we have an imbalance of bacteria in the gut, it can actually snip that tag off, and then our body reabsorbs that estrogen back into the body. So looking at the world of the microbiome, I know that's really exploding, and so much more information is coming out all the time on that, but looking at our gut bacterial balance, because if we're snipping that tag off of our estrogen and just hauling it back in, that's something that we're going to have to work on again to make sure that we are properly processing and eliminating our hormones.
That is so amazing. And, as long as we've both been in this field, I find the body's interconnectedness just endlessly fascinating. So I really thank you for elaborating on that point, because this may be new to so many women watching right now, and they might not have that understanding or insight that even just like elimination, like how important that is for hormonal health. I think that can be some breakthrough information.
And what we have to understand with women's hormonal imbalances is, we can have a whole group of women all with the same symptoms, and they might all have a different cause as to why that's happening. So one person, it might be digestive health. Someone else, they're making too many hormones. We just need to give them some help clearing them. Someone else may need some support in making hormones. So it's not a, one symptom, one treatment condition. It's really trying to figure out what's going on with this particular woman. Why is she feeling this way? Why are her hormones looking the way they are? And targeting that. And even though it's the same symptom, it could be a totally different treatment for two different women.
I think that's amazing to getting to the root, really understanding. And like you said, oftentimes the clients that are coming to you are the ones who are wanting to dig deeper. Like they want to know what's going on and understanding. And that the truth is that the root cause could actually be so many different things, even though the symptoms on the surface look the same.
Exactly. I'm just trying to tease through that and figure out what that cause is and addressing it on that level.
Hmm. So we talked a little bit earlier about stress. What is the relationship between stress and our hormones? And if there's maybe an example that you want to share.
So one of the big associations between stress and our hormones would be the production of cortisol that we make when we're under stress. It's a natural thing that we do. We're under stress, we'll produce more cortisol. And cortisol will go to the different hormone receptors and just get in the way. So we can feel symptoms of low thyroid function, but it's not our thyroid, it's the stress hormones getting in the way. So if we're going to address that, we need to look at stress overall. It can get in the way of the progesterone getting to the progesterone receptor. So our PMS can feel really bad that month. And it's not that the progesterone's not there. It's we need to work on stress and clear that cortisol out of the way. So stress and the physiological response to stress in our body, which is the natural response, is something that can really have a big impact on our feeling of hormone balance.
Which is really good to know. And it connects back to the idea of the root cause. Like you have to get to the root and really understand what's happening so that you can deal with the issue and then resolve the surface symptoms that are occurring.
Exactly. I see a lot of women coming in with symptoms of low thyroid function and they think, well, it's my thyroid, and we'll run a panel and no, it's not your thyroid. Your thyroid looks great, but you're having X, Y, and Z symptoms. So that's where I'm looking at something like that. Okay, so what else is happening? What else could be underlying this? You're making enough thyroid hormone, but you're still symptomatic. You don't need more thyroid hormone. We need to figure out what else is going on.
Mm-hmm. So, and I think it really speaks to how our hormonal health can impact our overall health. Like there are definitely, very real impacts on our entire system and then our experience of our daily life as well.
Absolutely. Like I said, women are the best experts of their bodies. They know when they feel off. They know when something doesn't feel right. They know. So it's just a matter of like trying to figure out the why. Okay, you're feeling this way. Why are you feeling this way?
Yeah, definitely. And it helps so much to have a knowledgeable guide to be able to get to it. So you have the best insight into your own body, but then having a guide to lead you down the path of really figuring that out is just so instrumental.
Yeah, there's a lot of interplay between hormones. So sometimes you just need to take that big step back and kind of get the lay of the land and realizing what's having an impact on what. So yeah, it does help to have someone guide you through that.
Mm-hmm. Very much so. And, speaking to stress as well, how might women adapt their self-care practices in times of high stress?
Oh, I wish it was a lot. But often when it's times of high stress, our self-care is the first thing to go out the window because we're busy and there's more on our plate and we're doing X, Y, and Z. And it just seems for some reason to often end up on the bottom of our to-do list for the day. So when it's our times of highest need, I often see that not happening. So again, it's coming back to prioritizing. We don't have to spend hours, but recognizing that, okay, I need to fit something in my day that's really going to help me feel better and move forward feeling more balanced.
Very true. So like you said, reprioritizing. And it sounds like what you're saying too is if you have more stress, self-care is that much more important to be, really consistent with.
Absolutely. Yep.
So, resilience is a topic that is really important to women's health, and it's a topic I love talking about. What does becoming more resilient mean to you, and how does it relate to the women that you treat?
So becoming more resilient to me means, being able to weather life's storms. Things are going to happen, and being able to kind of walk through that and bounce back from that, maybe even stronger on the other side. Is what resilience would mean to me. That could be something as simple as you have your day planned, you get sidelined, okay, shifting gears and moving forward with the new plan. And then there's things that can go on for months or even years. It's just being able to walk through that and come out stronger on the other end. What was the second part of your question?
So the second part was, how does it relate to the women that you treat? Your understanding of resilience and just resilience in general.
So there's always going to be things that are coming up in our life that are unpredictable. That's life. And so it's building that resilience to be able to walk through them, not have them take us down, to be able to walk out the other side and feel strong and feel good.
So it sounds like what you're saying is with respect to resilience, it's about being able to, go through the experience and on the other side, using it as a growth opportunity once you've processed your experience of it.
Absolutely.
Well, amazing. And I want to thank you so much, Dr. Lutz, for sharing today all of your wisdom and knowledge. And I have no doubt that women tuning in are going to really benefit from everything that you shared. There's some really incredible insights that I think, again, might be some breakthrough knowledge that women just have not been aware of or exposed to before. So I thank you so much for sharing.
Oh, I've been really happy to be here. Thank you for having me.
Thank you.